Hi everyone, welcome to this webinar organized by Weuni in partnership with emlyon Business School. My name is Martina, nice to meet you all, and I'll be your host for today's event on behalf of Weuni. I see here that the first people are already starting to join in. We are gonna wait a few minutes before starting to allow everyone to connect. In the meantime, if you want, feel free to say hi in our chat here on Zoom. And also, please tell us where you are from, because we are very curious about it. First of all, of course, I want to thank everyone for joining us and thank our panelists for being here with us today. There's few people that are writing in the chat from Lebanon, for example. Yes, I think we can start. So first of all, I want to introduce you all to Shaylee Malik, the program director, and also Geneviève France, the program advisor. And we have with us 3 students that will give us really useful testimonials about what it means studying at emlyon, and also maybe some tips. We have Monica Lee, Sydney Norman, and Arthur Pelos. Welcome, it's a great pleasure to have you all here. We know that in recent years, artificial intelligence has been revolutionizing the healthcare industry, enhancing disease diagnosis, optimizing treatments, and improving the efficiency of medical institutions. From advanced imaging system to data-driven personalized therapies, AI-powered innovations are redefining how healthcare professionals operate and make critical decisions. We are going to discover deeply this topic and to discover also the program in healthcare innovation and data science. You will also have the possibility to interact with our speakers and ask them questions. Today is really a great occasion since we have 3 students with us that just a month ago were in the same situation as you. Talking about that, I'd like to remind you that after the presentation, we will have a Q&A session. So don't be shy and just type all of your questions in the Q&A section here on Zoom. And we will go through them at the end of the webinar. Also, for those of you interested in receiving a certificate of attendance by Weuni for this free masterclass, stay tuned because we will post the link to get the certificate at the end of the session. So I think we are able to start now. Welcome to those who joined us. And without further ado, I am now leaving the floor to our panelists for their presentations. So enjoy the webinar and see you later.
Thanks, Martina. So as Martina already gave an introduction to us here, I'm Genevieve. I'm the program advisor for our Master of Science in Healthcare Innovation and Data Science here at emlyon Business School. The aim of the session today is to tell you more about the program, but overall get some feedback from 3 of our alumni who are here and answer all your questions. And as I am the program advisor, I'll be able to help you understand how to do your application as well. So we will touch on applying to the program at the end of the session. So I can hand over to we'll be looking at a few key elements of the program. So evolving job landscape in the digital healthcare era, obviously all the career options that are available for you if you do this program with us, and find out about the program, and then, as I said, talk to the students, and then we'll have the Q&A session. So thank you. Without further ado, I'll hand over to Shaylee Malik, who is our program director.
Thank you, Genevieve, and thank you, Martina, for the wonderful introduction. I'm Shaylee Malik, and I'm the academic director of this program, which is Master of Science in Healthcare Innovation and Data Science at emlyon Business School. Previously, we had a program which is the Master of Science in Health Management and Data Intelligence. which was a bit similar to this program, but now we have designed a new program which is more in line with the employability for the current healthcare sector. So without further ado, let's dive right into the presentation. So first, we are going to talk about the evolving job landscape in the era of digital healthcare, and how digital transformation is reshaping the careers in pharma, medtech, and healthcare consulting. So as you can all see from this image, the evolution of healthcare sector, it reflects a significant transformation from the traditional physician-led and paper-based systems to a highly digital, patient-centered, and intelligent ecosystem. Initially, healthcare relied mostly on manual records, which were controlled entirely by the doctors and the nurses, with very limited accessibility and efficiency. Now, this has evolved into digital record keeping, where physicians are now using electronic health records to monitor the patients and to keep track of their history, but the control and the structure of for the IT infrastructure, it still remains largely unchanged. As technology has advanced, a major shift has occurred towards the care being provided as more patient-centric, which is largely supported by wearable devices, remote monitoring, telemedicine, allowing the individuals or the patients to play a more active role in their health. The integration of real-time monitoring of the patients and technologies such as Internet of Things, artificial intelligence, augmented reality, it has really marked a new era, which enables a shift towards predictive care, towards preventive care, and of course, towards automation and smarter diagnostics. Looking ahead, the future of healthcare envisions a fully connected system by AI, big data, having secure digital platforms where personalized and proactive healthcare delivery becomes standard, fundamentally challenging the roles of the healthcare professionals and the expectations of the patients or the consumers of these for the service. As healthcare has undergone digital transformation, the job landscape within the sector has also evolved dramatically to keep pace with the new digital technologies and the models of care. The focus has shifted from purely clinical roles to a broader ecosystem that integrates technology, data science, user experience. Now, entire sectors have emerged or expanded, such as digital health. We keep hearing about digital health, telemedicine platforms, which I'm sure we all use at some point in our lives, healthcare IT infrastructure, biotech innovation, which demands a new skill set and interdisciplinary collaboration. For instance, the pharmaceutical industry is now operating at the intersection of biology and big data, while the medtech companies are blending engineering and healthcare delivery. So it's no longer just about the hospitals and the clinical roles. It now includes technology, data, innovation at every level. Now let's see how digital transformation is changing some of the job roles or the careers that are available in healthcare, especially in pharma, medtech, and consulting. So as you can see over here, we have I've listed some of the job roles that have recently or within the last decade they have developed as a part of adoption of AI and digital technologies in the healthcare ecosystem. So we know that in the pharmaceutical ecosystem or in the biotech sector, digital innovation is changing how the drugs are discovered, tested, and monitored. Data analysis, AI, and machine learning are helping companies develop treatments faster, more accurately. There's also a growing need to analyze real-world patient outcomes to see, how the medicines are progressing or how they are treating the individuals. There are personalized, tailored treatments that are available now for genetic and population health diseases. There's been a shift in the pharma sector beyond the traditional research and development into a more tech-enabled space. Similarly, if we talk about the medical device sector or the medical technology sector, this area is growing very rapidly. There has been a tremendous rise in the consumption of devices such as wearables, remote monitors, diagnostic tools that have essentially become key parts of the care for today's healthcare ecosystems. To support this, companies, of course, need professionals who can design, build, and manage these technologies, both from an engineering side or a technological side, and also from a user experience side. It's truly a field that combines healthcare knowledge with technical and design skills. So listed again over here for the medical device sector are some of the job roles that have come up as a part of the adoption of AI in the medical device sector, such as healthcare, Internet of Things engineers, user experience designers for medical devices, the developers of the technology for small wearables. So these are, of course, just a few roles which are mostly focused towards digital technologies, and but not to forget the traditional roles in the pharmaceutical and the medical device sectors that are already there, such as pharmacovigilance is there, regulatory affairs is there, and many other roles which we will have a look in a couple of minutes. But talking about one more sector that has evolved rapidly over the last decade is consulting. In the time of digital transformation, there are healthcare organizations which are still running on legacy systems. They also want to transform themselves digitally, and then they are turning to consultants or big consulting agencies to help them navigate this drastic change of digital transformation. Now it can be as simple as something which is implementing electronic health records, which we can say it's simple, but it's a highly complicated process given the challenges of interoperability and data security. And let's say improving cybersecurity or planning virtual care strategies. All these kinds of roles, they help providers, the healthcare providers and the companies to make sense of the changes that have been happening in the other sectors and now being adopted for the healthcare sector. So it's an area that blends healthcare understanding with digital strategy and problem solving. And just to share with you guys, consulting is a very important sector for the graduates of our program, where more and more students are now wanting to become consultants in the healthcare space. Just to summarize, a little bit, that the future of healthcare is indeed hybrid. The future of healthcare jobs will increasingly require technical skills, of course, clinical skills and analytical skills, which can be data analytical skills or interpersonal analytical skills also. It's going to require technical know-how and, of course, data fluency. We will be seeing more roles that are cross-functional, that are cross-traditional boundaries, where the professionals will need to understand both the science of the healthcare and the digital systems that support the healthcare delivery. The shift is going towards smarter clinical systems, which are more integrated, and that's how the industry is getting shaped currently. And to be a part of such an industry, which is currently undergoing a digital transformation, there's a consistent need of upskilling in data science, digital tools, and health systems. And this is pertinent if you want to truly bring a change in the healthcare systems worldwide, in your country or in any other place or wherever. These kinds of skills are mandatory to have. And lastly, just a small point, digital transformation it's not going to replace the jobs. It's on track of creating more smarter and more impactful jobs, if I must say. So so if we talk about digital transformation, and so there have been so based on the employability trends of the sector, having a clear understanding of what state of digitalization is the healthcare sector in, and what we need to learn and what we need to adapt to bring change to the healthcare sector, and considering the challenges that the organizations face while adopting the digital technologies, we developed this Masters of Science program, which offers advanced training in the management of innovation, which can be development of new products, development of new services, or adoption of digital technologies on legacy systems. And of course, it's going to also involve change in business models of the companies. Now, it's quite important for the healthcare sector to move a bit, slowly in terms of adoption of digital technologies, because the transformation is slower because of many factors, such as the regulatory environment is quite strict for healthcare because we deal with human data. We have to think about patient privacy. We have to think about cybersecurity of the data. It's a very complex system. And of course, it needs a high level of security and trust to be able to adopt something which is, let's say, on the cloud. Additionally, the adoption requires, careful integration with the older legacy systems, and it also requires extensive trainings for the healthcare professionals. Now, it has created a lot of different kinds of positions or roles that we just briefly glanced over due to the adoption of AI. But even then, as the digital technologies continue to evolve, the sector is rapidly catching up. It's progressing at a much faster rate as compared to other sectors in terms of AI adoption as of now. The organizations, the healthcare organizations, are increasingly recognizing the need for the skilled professionals who can help them in the digital transformation, and that has created a demand for this critical intersection, which is the healthcare, business management, and data science. Now, this program is entirely designed to address that need, providing the future graduates competencies that are required to drive innovation and efficiency in the healthcare industry. Just going very briefly over the main modules of the program. We have talked about this in the previous webinars, and it's also there on the program webpage. So I'm not going to go into the detail for that, but let's say very, very briefly going into what we do in the healthcare systems and ecosystems. It's about, understanding what is innovation, what is healthcare innovation, what are the main factors that govern innovation, how has the healthcare innovation been, it has gone socially in terms of, ancient aspects. What are the now business ecosystems for the healthcare? And of course, we talk about, the major ecosystems, which are pharma, medtech, consulting, startups, and what is digital health. Now, all this, of course, is going to be complemented by data science and analytics, where the students will cover the fundamentals of data science in year 1 and some courses on advanced data science and analytics in year 2, supplemented by business modules. So fundamentals of business, some courses such as project management, basic finance skills, and marketing covered in year 1 and year 2, and going on to business information management, healthcare consulting, web analytics in year 2. And parallelly, we'll have another track, which is the professional track, which is going to teach soft skills to our graduates, such as leadership, collective intelligence, how to work in multicultural environments, and of course, talking about entrepreneurship, which is quite at the heart of emlyon. So with that said, I will give a very, very brief introduction into the student profiles that we get, and talk a couple of more slides about the careers that our students have been doing after graduating from the program. So as we have previously discussed, our programs are quite international. Just to give you an idea, this year for the health management program, we have a smallish cohort, 32 students, and they come from 16 different countries. You can see that the cohort is majorly international, mostly female, or let's say more than average for female. And we do have students who are coming to us after several years of work experience, so that the average experience is about 3 years for the program. In terms of the academic backgrounds of the students that we get and that we accept in the program, majority of them do come from the life sciences and the pharmacy sector. Some of them are medical doctors, they are dentists, but nonetheless, about 1/3 of the students, they do come from management background with business administration, economics, and even from engineering and nursing and arts, as you can see over here. So this brings quite a diversity into the cohort, and it really makes things interesting when you have to work on group projects. So this is just again to give you a bit of sneak peek into the career profiles and the job domains that our students can venture into after finishing the program. So as you can see over here, the ones that are highlighted are the ones that the majority of students go to, which is of course, R&D, being a product owner, product manager, data analyst. They also go into business development, data management, strategy and innovation, which entirely deals with the digital transformation, as we just discussed, sales and marketing. But nonetheless, it's going to depend upon the qualifying degree that you have done, your previous experience, professional experiences, if any, and of course the field that you want to go in. So as you know, the cohorts are quite diverse that we have. So such diversity is also reflected into the kind of positions that our students go on to eventually take after graduating from the program. And to give you a more deeper insight into how when you enter the program, and when you go through the program, and we know how the students, the past graduates from our program have taken their academic backgrounds and possibly gone into other areas to work. So now we have the Q&A session with some students of the health management program from the 2023-2024 cohort, and I'll let Genevieve introduce them. Thank you.
Thanks, Shaylee. That was a lot of really good information about the program and all the job prospects that are available following on from the program, depending on your background and what each student really wants to get out of the program. So obviously that's great. So as you said, we're here with 3 alumni today. So we have Sydney, Monica, and Arthur. So as you can see, there's a little bit of a background from each of the students, but it would be great if each of you could maybe introduce yourself, tell us a little bit about your academic or professional background before joining the program, so that we can find out how diverse the profiles really are of the students on this program. So I guess we could go in order. If we could maybe start with Sydney and then do Monica and then Arthur, that would be great.
Hi, yes. So hi guys, my name's Sydney. So I am from the US, from Texas. I grew up always wanting to do healthcare, and I decided to do the nursing track. So I did my bachelor's of science in nursing. After that, I moved forward with my nursing career and did about 2 years of experience in emergency nursing care. And then following that, I had decided that I really wanted to do more than what I was doing currently to help the most people possible. And so I started looking for programs and found this program here, Health Management and Data Intelligence, and decided to further my career. So that's my background.
Great, thank you. And Monica?
Thank you, Sydney. So hello, my name is Monica and I come from Taiwan. So before I came to emlyon for the program, I was doing my bachelor degree and it was major in finance. So at that time, I find finance very broad for me. So I want to like integration it with a specific field. And after that, I found a internship in Shanghai in a healthcare sector and a healthcare company. So I found there is a large potential in the healthcare sector because, like even in Shanghai, like the major city, one of the major city in China, there is still a lot of people that cannot obtain the like qualified healthcare service. So I found it's quite interesting and potential in the future market. And so I searched for the program for healthcare, and I found there is a one that combine healthcare and data in emlyon. So like data is a very huge part as well, like because it's digitization all day now in the business sector. So I found the program is very interesting. So that's why I come to the emlyon for the program.
Thank you. And last but not least, Archer.
Hello everyone, so my name is Arthur. I'm French, as you can hear with my accent. I'm from Paris, and when I was young, I wanted to be a doctor, but unfortunately, I did not achieve this. So I flew to Canada and I did a bachelor in science in kinesiology, which is health and sports science. And I had ended this kind of pathway with a final internship in a brain lab where we were studying how Parkinson's disease people were dealing with sports and with their health in general. But I wanted to also to see the economic and data parts of the health. So I found this master, which is in France. So I came back to France, and it was very, very interesting. It was a very complement to the first very scientific part of my studies, and thanks to the economy and the data and all of these kind of courses that we had. Today I ended my internship with a CDI, and I'm very happy in my work. And thanks to the master, it helps a lot to what I did today, to what I do today.
Great. Thank you. We'll touch probably more on your career and everything as we go through the webinar. But obviously great to hear that you managed to get a full-time job following on for your internship that you did with the program. Maybe before we talk more about the career as well and internships, it would be interesting to hear from all of you, maybe a specific part of the program that you really enjoyed, maybe a class you found specifically interesting, and as well talk about the TEM course, which is the entrepreneurship project, group project that you all had to do. So I don't know, if we go back through to Sydney and then on to Monica, if you feel free to chip in with anything that you all enjoyed throughout the program.
Yes, of course. So if we're going to talk about my favorite class is probably the class I didn't expect to do well in. I came from, as you heard, a nursing background, so I wasn't very tech savvy. So we had to take a Python class. If you don't know, Python is coding. And my brain does not make sense of how coding works, but it was the class that I learned probably the most from, because it taught me how to think and work a different way. And I think that's very important about this program, is that you'll be in a lot of different classes, as you saw, in short periods of time. But what it does is it helps you think critically and think in different ways. And my other class was the AI ethics class, because the AI ethics class can get kind of heated because we all have different feelings with AI in healthcare on what should be allowed, what shouldn't be allowed, culturally, the differences in different countries. And as you're in a class that's very culturally diverse, you come across a lot of different opinions, and to be able to talk about it openly in that class was probably also one of my favorites. And then TEM was intense. For our program, it was a 3 or 4 month length class where we were in groups and we assigned ourselves a role, so CEO, CTO, CMO, etc. And we had to come up with a startup all on our own. We had to come up with the marketing plan, the finance plan, and everybody had to fit in their role and work together to create a business that we had to pitch in front of real people, like experienced people in their jobs. And I think it was a really intense, very helpful experience. That TEM was, at least for me. But Monica, what do you think?
I agree with you, Sydney. So my favorite course, I will also say TEM because it's for me, it's the first time to learn something about the entrepreneur program. And also, like Sydney mentioned, we are in charge of different roles in the team. So at that time, I was CFO in my group, and it was my first time to apply my finance knowledge in a practical and on-hand experience way. So that gave me a like deep impression on it. And also, we use tools like Excel, VBA things, which also like very helpful for my internship later. And also, I agree. I would also say Python left me a deep impression. Uh, but I would say at that time, I didn't find it very interesting. But after I get my internship, I found it's very useful for my internship thing because what I did in my internship is doing the automation. So basically, it's using like a coding tool to do the automation thing. So Python, like the concept I learned in Python, it's very helpful for me at the time. And the other course I want to say is about a intercultural communication. I couldn't remember the exact name, but it's the course like this because we are like working in a very diverse program. So people are from different countries, and also my internship is like very international company. So I would say what I had in the intercultural communication course really helped me to like communicate with different people, knowing what to say and what not to say. So I would say these three courses are my favorite.
Thank you.
Me, I would say that my favorite one was the pharmaceutical world of economy, if I remember right, the name of the course, because it's maybe the thing that I use the most in my job today. It's about the pharma world and how all of the laboratories works and all of this kind of pharma world, but also the European policies we had about ethics and GDPR and all of the rules that are running over health and how AI and data is getting more and more important and how we have to have some rules and some laws and some either from the federal or even a bigger step point. But I think it's mostly because that's what I use the most today in my job. But yeah, of course, the TEM course was the most engaging one because it was like kind of real life. We were creating a company from scratch. We had to do everything. We had to choose the role we have. We have to manage a team. We had to pitch the project in front of a jury. So it was very, very interesting and the one that feels more real. And at the end, maybe it's something that we use every day, either from knowing how to work with each other or knowing what you can do and what you can't. Being able to help others, to admit that you can't do everything by yourself and that you can, yeah, create everything from scratch. So TEM was really amazing and really engaging for all of us, I think.
Great. And you touched a little bit on, Arthur, about the classes helping you in your internship and your job now. Maybe you could start off telling us a little bit more about your internship and then what happened and how you then got into your full-time job.
Yeah. So I found my internship at Doctolib. For those who don't know, it's it's like a platform where you, as a patient, you can book an appointment for a doctor. It's very big, like very, very big. It's almost all across Europe. In France, we have 50 million active users, so 50 million patients out of 68 million. So it's very big. We have close to 300,000 doctors on using everyday Doctolib, and we have many solutions for doctors. So it's very big. And me, I'm working in a business unit where we are doing health prevention. So we are using the fact that we have a lot of patients using the app to promote prevention, to promote health reminder, to promote health tips on how to get like a good health and how to keep it good. And these campaigns we are sponsored by big laboratories and by associations and also by the public community. I mean, the public health minister, the health minister, yeah. So at the public level. So we are working with everyone, with a lot of kind of actors that are engaged in health in France, but we are also in Germany, and soon we'll be in the UK. And that's why I said that the economic class of the pharmaceutical world is very important, but also how the laws and rules and GDPR is very important too, because I'm using it every day. But yeah, I also think that the fact that we did TEM helps me a lot to understand how to work with different kind of team in the company, because it's a huge company. Doctolib, we have more than 3,000 people working there. So you have to work with a lot of people. You have to know the health world from a French point of view, but also from a European point of view. And with what's happening in the US right now, we are kind of trying to go over there, but it's hard. So you have to know like kind of everything. That's why all of these classes were very, very useful for my job today.
Great. That's really interesting to hear and find out everything that you've managed to do already, even though you graduated not very long ago. So that's amazing. And also, and going to Monica, you also mentioned that the Python class then helped you with your internship. So maybe you could tell us a little bit about the internship that you got and where you're at now as well, following on from the program.
Yes, thank you. So my internship was in Biomercure. So it's a very big company and based in Lyon. So basically, it's a in vitro diagnosis companies. Like for example, we take the blood from the patient and then we provide the tools like the machine to test it in a very efficient and accuracy way. So this is basically what the company is doing. So my internship was in the finance department because I have the background. And what I did in there is to do the automation thing. So basically, there are lots of manual works currently, and it's not easy to trace for the employees. So what our team going to do is to digitalization of it, like building up the automation flow or apps to help people to like trace and to let the process to be more transparent and easy to access. So by achieving this, we use a lot of tools like Microsoft Power Automate and Power Apps. So this kind of low-code, no-code tools is including people who don't have like a specific coding background, but also can use the tools to help to build up the automation thing. So what I learned from the Python is very useful in this kind of situation because I don't have like coding background, but I still can use a little bit coding to help the team to build up the automation things. So yes, and that's what I did for the internship.
Great, thank you. And last but not least, Sydney, maybe you could tell us what you took from your classes, what you did in your internship, and how you used the tools that you learned for your career and where you're up to today.
Yes, so I kind of actually did the exact opposite of what Arthur did. He went to a big company and I went to a startup. So our startup, when I started the internship, was only 6 people total. It is a startup called MS Insights. We work in AI, so we build an algorithm that detects a mutation in your genes for cancer, and that helps doctors find the best treatment if you have that mutation. So when I joined MS Insight, I joined as a marketing intern. Now, if you heard my background, it was in nursing, and if you heard the program, it's not marketing. So I had to learn very quickly how to adapt. But the reason I was able to adapt so well to the position was because of what we learned in school. So in the courses, you have, I don't know, 20, 30 different courses, very short periods of time. It teaches you how to be adaptable. It teaches you soft skills like learning how to talk to people. It teaches you problem solving skills like in the ethics class when you have a disagreement with a student. It teaches, the TEM class teaches you how to help manage depending on your position. And that's what I learned there. And it worked out for me. So I ended up getting a permanent contract with them in Lyon as what's called chief of staff. So right-hand man of the CEO. And so now my job is a bunch of things. So I do financing, marketing, operations, and HR for the company. And we are now up to 9 employees in total. So we are growing. And that's kind of what I've been doing for this startup company. And I see someone pointed out a specific question for me. I'm just going to answer that real quick. So living in Lyon is fantastic and great. But as talking about the overall experience as a student in this field, it is different. It is very different. So I'm American, but I am also French, but don't speak French. Don't ask me how that happened. But anyway, it is very important if you want to stay in France long term that you help speak the language. It is a benefit for some of these companies, but I will tell you it's not a necessity. I got this job with a French company, not speaking fluent French. So it is possible, but living in Lyon or living in Paris, as the question asked, is a great opportunity for students in this field if you know where to look. And you'll find that with emlyon, they provide lots of different opportunities to meet companies, to talk to people, and give you resources. So you don't have to worry about that with this school. The outreach is very good.
Well, thank you. That was also add a little bit as an experience as an international student living in Lyon and Lyon being a pharmaceutical hub. That was great to hear as well from you, Sydney. Thank you. I'm just looking at the time thinking we could maybe quickly talk about how to apply to the program, and then we could go through any of the questions that have been added into the chat box, unless anyone has anything they really want to add, any of the alumni. No? Great. So applications are currently open for the program. The program is a 2-year course. So depending on your background, you can apply into either the first year of the program or the second year of the program. So if you only have a bachelor's degree, a 3-year bachelor's degree, you're eligible to apply into the year 1 of the program and then obviously do the 2-year course. If you already have a master's degree or a 4-year bachelor degree, you will be eligible to apply directly into the second year and then just do the program in 1 year. I also just wanted to touch on the opportunities. We do have some scholarships that are available. So when you do apply, feel free to reach out to me to ask for any further information. But we offer an excellent scholarship based on a management test score, as well as an individual scholarship based on profile, background, and what you can bring to the program. So definitely feel free to reach out to me and find out a little bit more about that before you do apply. As I said, applications are open now, and we have an application session that's ending tomorrow for results middle of May, and then there'll be another session, but then the results will be much later. They'll be in mid-June. There's a great chance if you are considering applying to send in the application before tomorrow, end of day. Yeah. And then also what you need to apply is, oh shit, if you could just go, yeah, thank you. It's quite easy. The documents that most of you already have already. So to send in an application file, you have to have your CV in English, a copy of your bachelor's diploma or any higher education that you do have. If you're currently doing your bachelor's degree, a certificate of enrollment, as well as all your academic transcripts from your higher education and a valid ID, ideally a passport. And then also optionally is a academic or professional letter of recommendation. Then once you submit your application file, you'll do online digital tests with us. Again, if you want more information, I advise reaching out directly, but the online digital test is basically an opportunity to tell Shaylee, as well as the other members of the jury, your motivation to join the program, your academic background, find out more about you. It's in a video and written kind of question and answer format directly online, as well as a section which is like a management logic test. So, and then once you submit everything, you'll get the results within about a month, depending on the sessions. So yeah, that's how to apply. And then I guess we could maybe go over to the questions. I see we have 11 questions and about 15 minutes to go until the end. So we can maybe go over to the questions in the chat.
Absolutely. Hello again, everyone. First of all, of course, I want to thank our panelists for the accurate presentations and all the students for the useful testimonials. Yes, as Genevieve said, we already have some questions from the participants. I'd like to remind you that there's still time to ask questions, and you can do so by writing in the Q&A box. So I'd say let's start with the first one. I think this one is for the students. Did you find this program to be well recognized in the industry? How was this program helped you to excel professionally? Who wants to take this one?
I can talk just for a second, and Arturo or Monica, you can jump in. Yes, it is well recognized. Number one, the school. If you have emlyon written on your CV, your resume, it automatically is known as one of the best schools, not only in France, but one of the best schools in the world. The specific program is relatively new because data intelligence is relatively new. But because of that, it's a learning opportunity for when you talk to your employers, which is fantastic because they want to learn about those things. But two, it catches the eye. So it's very eye-catching when somebody sees, data intelligence, especially in this data evolving world. And so I think that's really, really good. But yes, it is well recognized. And the program is, like I've talked before, has helped me excel professionally. I mean, it is what found me my internship and got me the full-time position. But I don't know if Arturo or Monica have their own take.
I would say exactly the same. Like emlyon, I'm French, so emlyon is one of the top school in France, and even all over the world, as Sydney said. Because the program is kind of new. I mean, the recruiter doesn't know for sure the program, but they know like the title of the program, and then when you explain what did you study and which kind of classes did you have, like it's very, very interesting and it catches the eye, as Sydney said. So yes, it really helped me to find my internship and then to have my job, and as Sydney said too, to excel in what I do. So yeah, emlyon, it helps a lot.
Yes, I totally agree with what Sydney said. And based on that, I would like to say, like when you entering the company, you based on like your graduate from emlyon, you have a lot of networking with a colleague there. Like you can see some colleague are like was in emlyon for 20 years ago. So you have a lot of connection with this title. I would like to add that.
Thank you all so much for answering that. Let's read another one. So I think there are two questions about this. Will any classes be on campus, or is it completely digital? Or another student asked if there are any only digital courses.
Okay. So I can take this one. And so this is an in-person program. It's a full-time program. It's also not an alternance program. So depending on the preceding degree that you have, you can enter in year 1 or year 2, but it's a full-time program and in-person program. Some of the course sessions can be done online, but those are very far and few, I should say, but it is going to be delivered at the Lyon campus. We have several campuses across the world, but it's going to be delivered in the Lyon campus.
With an international period.
Oh, yes, with an international period, right.
Yeah.
Thank you so much. Here's another one. Do you have partnership with hospitals or pharma companies or public health organization?
Okay, so the program does not have any partnership with hospital or pharma industries, but what we do have is that, let's say if we talk about the pharmaceutical ecosystem course, so in each of the course sessions, the professor who delivers the course invites people from the pharmaceutical sector to talk in each of the course sessions. And similarly, we have about 50% of the professors teaching in the course, they are permanent faculty at emlyon. And about 50% of the courses will be done from professionals who are working in different sectors of the healthcare industry. So you have a lot of chances to network with those individuals, a lot of chance to network with professionals, talk about different careers. And of course, it's going to help you, enhancing your circle and finding more opportunities in the field. So let's just to give you an example, the course on medtech ecosystem will be delivered by professional. He's a PhD who has almost a decade of experience working in the digital health sector for Merck. To give you another example, the course on healthcare consulting will be delivered by a consultant from LCMed, which is a French healthcare consulting company which specializes in the healthcare sector. So this is just to give you an idea that how much involvement there is from professionals in our program, and we do not have direct partnership, but different companies contribute to different courses within the program.
Thank you so much. I think this one is also for the students. What kind of networking opportunities have you found most valuable so far, like industry, events, alumni, professors? Who wants to take this one first?
Maybe I could go first. So I would say about the seminar and webinar is what I gain a lot from school. Like, for example, the first step I contact with my internship company is from a seminar that at the end of the first semester, I remember. So the company, like there are several companies come to the school for the seminar, and during the meeting, I had the connection with the people who in the company, and like we talk, and after that, I found my internship position from that. So I would say I gain a lot from a lot of seminar and webinar from school.
Thank you, Monica. I would just like to add on here that we have a careers department at emlyon, which regularly organizes different conferences and different seminars with the professionals from the healthcare sector. There's a dedicated career forum, which is a 4-day event at our campus in Lyon, 3 days. This year, approximately 180 companies came to our campus at Lyon. Of course, the majority of the healthcare companies are a bit in minority, but they do come to our campus, and they have their special, stalls in the campus where you can go and interact with them. You can find more about the opportunities that they have currently or that they are going to have in the near future. And we have an event called Lunch and Learn with the healthcare companies where 6 focused healthcare companies will be coming, and you can have like an informal gathering with those companies, have a lunch with them, and it's a very informal session where you can talk about opportunities and learn what they do at their company, what kind of profiles they are looking for from the students. Apart from that, we have a career week and numerous webinars going on almost every day at the lunchtime to prepare you for your professional journey. Apart from that, as I mentioned before, a lot of professionals intervene in the program. A lot of professionals are invited even if a permanent professor is delivering a course, they do invite professionals to come and speak to you. And then we have an international learning week, international seminar, where the students travel for 1 week to another location within the Europe. And we do visit different kinds of companies of the healthcare ecosystem, pharma, medtech, consulting, maybe legal firms, maybe a startup or an innovation hub. And that also offers amazing opportunities for networking. We have an alumni association at emlyon, which has about 45,000 members, and it's a great resource to be connected to different individuals or alumni working in a company that there is. Lastly, there's a career platform for emlyon Job Teaser, which regularly has the advertisements for jobs and internships posted. There are a lot of career tips. There's a lot of material of help over there, and we have career guidance sessions also. You can have one-on-one sessions for career guidance, employability guidance. They are integrated into the program, and of course, you can add on different appointments also. Thank you.
Does any other student wants to add anything to the question? I don't know. Okay, so I will read another one, I guess. So there are a few questions about the applications, fees, something more technical. Maybe you can do an overview about this.
Yeah, so there are application fees to the program. So to send in your application file, which were the documents that I touched on before, you then have to pay 120 euros to send in your application. So yes, there are application fees. It's 120 euros. And then I also saw there was a question about the price of the program. So the program cost is going to depend on if you're doing a 1-year program or a 2-year program. So obviously that does vary. If you join just for the 2nd year, for instance, you will be paying 28,750 euros. However, if you do the full program, you'll be at 38,750 euros. So it's depending on if you're doing a 1-year course or a 2-year course, of course. Yeah. And then I also saw that people were asking again about the scholarships. So as I said, we do have scholarship options, which are possible up to a maximum of 50%. It really depends on profile. It can also depend on like the financial situation of your country that you're coming from. Also depends on your academic background. It kind of also just depends on what we think about your application. If we just really, really love your application and want you to join the program as well. So everyone is able to send in a request for an individual scholarship, and you can send a paragraph explaining why you believe that you deserve this scholarship. It's not just for financial reasons, it can just be about your background, why you believe that you'll be a great student in the course. And then based on that, we will decide if we can give you a scholarship and how much scholarship we can offer you. So this is when you send in your application, you fill in the form.
So I think we have time for one last question. I have maybe 2 that are very interesting. You can decide if maybe, I don't know, do both of them, because there's someone asks what was the student social life like? So maybe our students can add anything to this. But another student asks, can you work and study at the same time? So maybe it's the same field, but with some difference.
Yeah.
I can start to answer if you want. So as we said since the beginning, it's a full-time program, so it's very, very intense. Like we had classes from early in the morning to late in the afternoon. So I'm not sure that you have time to work on the side of your study. And the social life, it was very nice. We had plenty of things to do together. Even the week we had abroad, it was amazing, and even the international semester abroad was so nice. So It's very, very good. And at Emlyon, I mean, we were in the old campus, so it was different. But I think also in the new campus, you have like a cafeteria and everything to deal on the campus. So really, the social life was very nice.
Yeah, to add on that, yeah, as you said, working and the school's full time, as Shaylee said, it's a full-time gig. Now, technically, could you dog sit once or twice because you want to walk a dog and get $10? Sure, you could do something small like that. There's an app called Rover. I used it in the past. You could do something small like that, but I would recommend not working a job that requires many hours. It's not going to work. Your focus, you're paying for the school. So you want to focus your attention on what you're learning, studying, making sure your projects are 100%, putting whatever else you can, doing extra work on the side on Python if that's something you were terrible at, like I was. So it just depends. And then the social life, because it's a smaller program, these people are going to be your best friends for the next year and a half, okay, or 2 years of the program. The new program is 2 years. And so you're going to be spending a lot of time with these people. And yes, you're going to have little groups here and there, but you're going to become like a mini family. And so the social life is great. The school itself throws little afterworks sometimes at the school. So you're going to have a lot of opportunity to meet people from different programs. But just remember, you're going to get really close with the people in your program. And it's a great opportunity to meet different people.
And yeah, definitely do not work in a bar or in a restaurant. You will not have time.
No, please don't.
Okay, I think this was a great way to end this webinar. So our time is unfortunately over, but do not worry because you can keep in touch. We will send all the participants an email with the recording of this session and all the contacts. First of all, of course, I want to thank our fantastic guests for the interesting debate, the super interesting testimonials, and also thank everyone for joining us. I'd like to remind everyone interested in receiving a certificate of attendance by Weuni that you can click on the link that I am sending in the chat right now and request it. Before we say goodbye, I'd like to ask our panelists if they would like to leave our participants with a message, maybe.
I would just like to say, if your question wasn't answered, feel free to get in contact with me. You can go onto the application page and you'll get all my contact details. So any further questions, please don't hesitate in reaching out. And I'm very happy to help with any applications.
And if you have any questions about life in France, life with the program, feel free. I was the class delegate last year, so feel free to ask me any questions or anything. Not last year. No, last year. Yeah, last year. Feel free to ask me any questions that you want, and I'll be happy to answer them.
Okay, thank you so much to all of our speakers and everyone connected with us today. I hope to see you again in the next webinar organized by Weuni. So bye everyone and have a nice day.
Thank you.
Thank you
Thank
so much,
you.
everyone.
Thank you. Bye.
Thank you, everyone.